I'll be speaking on behalf of Matt and myself. So epidemics are bad. We're all familiar with the Ebola epidemic of the past year that's killed over 10,000 people already and keeps going. Influenza has seasonal epidemics in the United States that kill 3,000 to 50,000 people every single year. This even pales in comparison to what a pandemic would look like, where we could have billions of cases and millions of deaths. Of course, the impacts are not just deaths, but a lot of other impacts on society. Economic estimates of those impacts easily get into the billions and climb into the trillions for what a pandemic might be. Those are just Ebola and influenza that I've talked about. There's a whole lot of other pathogens that can cause epidemics affecting thousands or millions of people. And some of those are known and some of those are unknown. There's a lot of challenges associated with these epidemics, but thankfully there are some things that we can do to reduce their impact. The key, though, is that those are also costly. The interventions such as vaccination or other control efforts are also costly, so it's really important to do them at the right time. But the right time is often early in the epidemic when it's hard to predict what's going to happen. So this is a fundamental challenge that we face in public health, is that epidemics are hard to predict. Thankfully, there's also a lot of people working on this, including Matt and myself. In some of the work that we've been doing, it became really clear that while there are a lot of people working on very key components of this, there are some critical connections that are being missed. And we wanted to think about ways that we could face some of those. So let me give you an example. This is Alex. Alex is a professor at the Northeastern University. He does a lot of great work on epidemic prediction, but also faces some important hurdles. So one is that it's hard to get input from decision makers. In the end, he wants to inform decision makers so they can make better decisions. But what is the information that's most useful for them? Another is data access. So what is the right data? How can you get access to it? How can you process it? These are all challenges that take time, and that's not really Alex's forte. Model comparison is another issue. He wants to know how his models compare to others so he can understand the advantages of different approaches and figure out how to make better models to make better predictions. So we talked to a lot of other people in academia, in government, and also in industry. We found that they had very similar related concerns. So these are the three of the key challenges that people face. One is targets. What should be predicted that can actually be helpful for public health decision makers? Two is data, the same concerns that I mentioned before, that it's hard to access, hard to figure out what's the right data and how to use it, how to interpret it. And three is evaluation. And that's both for people like Alex who want to figure out how to make their models better, but it's also on the public health side who at some point needs to determine whether models and predictions are credible enough to be used to actually make decisions. So given these challenges and all the work that we know is going on each of these components, we knew that we didn't need to create new content. Rather, what we needed to do was help these people connect. So we decided to build a web page. We built a prototype web page for the Epidemic Prediction Initiative. This is what the web page looks like. It's live and active now. It's built on open source tools that are easily scalable. We built it up for one specific challenge, which is an influenza prediction project that's been run out of the CDC for the last 2 years. So the idea here is not to create the content, rather to give a way to make the content more accessible, all the content, all these different components more accessible to the community to help galvanize these efforts and push them forward. The first thing we did was add information on the targets. We made a very specific definition of what the target was, but also why that's an important target, and more detailed information about the details, exactly what an epidemic week means, for example. Then we made the data easy to access, so that rather than digging through different web pages, you could click on it and get the data immediately. Also more information about exactly the metadata related to prediction efforts so that people could better use that data. Lastly, we added an evaluation component. So we actually put the predictions that the teams had made up online so that they could see them. We also put in a quantitative evaluation of them so that they can look at them quantitatively comparing to other teams. They all found this really useful, the people who are participating in this competition now. And we're really excited to use this going forward because it'll make their lives easier, it'll make their predictions better, and it'll make it easier for them to continue participating and more likely to continue participating. And in this challenge and other challenges like it too, because these people are also interested in other diseases. So given that, we want to push this forward. And there's a number of things that we need to do in order to do that. So we need to establish organizational support, and that's both sort of technical but also financial. We need to complete the initial development, and we need to develop plans both for the technical maintenance in the long term, but also the scientific side, making sure we get the right projects and right information in there. What we want to do in the end is make better public health decisions. To do that, we need to connect research, data, decisions and the public health problems. And we think that with all these things together, we can do a better job making better decisions to protect people from epidemics. Thank you.
All right, who wants to start? Brian, you're new.
Yeah,
Go
it's
for
like I
it.
have 500 questions. I'm only going to ask two. One, this is really awesome and it's interesting. And it reflects one of the challenges of bringing modelers together and sort of the data users together. Is this what was involved in the flu challenge this year? Was it one of the tools used by the participants?
So we started the flu challenge in October, and so this tool wasn't available, but during the second running of this contest, we were really talking to the contestants, figuring out what's really the challenges for participating in this contest and what would they want to see going forward, and really the data access was one of the first things that bubbled up, and then they were really excited once we put their predictions in one place where they could look at how they were doing compared to other teams and how they were being evaluated kind of quantitatively. So it was really implemented kind of halfway through the contest this year, but has been great for us and for the contestants.
That's cool, because the other question was sort of how you get the participation, and it sounds like the community is sort of looking for this and really gearing towards it. So having it available to connect to other researchers is really valuable.
Definitely.
Yeah, they really just asked for more.
Do you guys think that the analysis of each of the team's predictive models and the comparison of those models will enhance the sort of algorithms in the future? I mean, will they look at what other teams are doing and feel competitive, and will that competitive sort of spirit allow them somehow to do better, do you think, or is it just sort of an informational only thing?
I definitely think we can see an analogy to this through weather forecasting. So NOAA's been tracking the accuracy of forecasts since about 50 years ago and putting this publicly available. And you can see the accuracy of forecasts have just gone up in magnitude since they've been tracking this. And we think the same sort of kind of space where a central agency is putting these kind of quantitative metrics out there so teams can see, well, this model is doing well and they're using this data, or they took this modeling approach and it's doing well. We really help them think about, well, these are the approaches I'm taking with my model. Maybe I should look elsewhere or think about this new data source, and it will make them better. We actually had a meeting with our participants about a year ago in our first flu contest, and just that day of bringing people together, people who are really good at getting the data and providing it started sharing it with others in the community who were better at the mathematical modeling part. And we think this is just one small example, and if we keep doing this in different pathogens over the years, they will have a community that does improve the accuracy of forecasting.
That's very cool.
So this is Shark Tank, but I might throw you a red herring here. And I'm reflecting on things I see that cross my screen that consist of real simple things, word clouds, other kinds of, quasi-metric. It's softer data. But I'm struck by how often the public might begin to see something, and so they start searching on Google or they go on to WebMD. So is it possible to, and I don't want to sound like NSA either, but is it possible that you connect with, and I think CDC's nibbled a little bit at this, but to integrate some of the softer data from searches and other forms to try to triangulate and perhaps look at that as a real-world pulse at the real community level, not the expert user, epidemiologist, medical community.
Yeah, so there's definitely a number of efforts like that are going on. And that's not, so we want to really provide a forum where you can use any sort of data to try. So this is not necessarily the data you need to use to predict, right? This is the data you need to measure how well your predictions are doing. So that opens it up so that the community can really use whatever they want to try to get at that. But we're at least sort of trying to set the standard of what we want to get to.
I just have a question about how you see this going forward within your team, and how do you see yourself keeping the excitement up post the Ignite, post the Ignite phase? And have you thought about setting up small but realizable milestones that you can feel that you can hit along the way, and if you had any thoughts?
Yeah, so we know that we need like some concrete steps on the organizational side, that it has a home and we get some funding at least for it. We know that we also have buy-in now from our supervisors to continue working on this. So we have the flu season that will come up again. We'll probably use it again for that. We have another dengue project that's working with the White House OSDP moving forward, so we're hoping that we can also use it for that. So we have these things happening, but we also need to go take the next step and institutionalize it at some point. So I think we have like a pretty definite path forward, but we also need to take the step to make it really official at some point in the near future.
All right, guys, we're out of time. Thank you very, very much.